Hey guys, I am so excited to introduce you guys to Dr. Genz. She is a dentist and not just a dentist, it's a holistic dentist. So, we're going to talk a little bit about that because you're not going to find anyone that does anything like this. It's so cool. So, I'm really excited to introduce her. She's with Whole Tooth Dentistry. And she's not too far off from my office. So, it's really, really awesome. So, tell us a little bit about yourself. Welcome, welcome.
Thank you. Thank you. I'm excited to be here. So I am a holistic dentist or a biological dentist. I have been practicing for a while at this point, I think 15, 20 years, 15. Not make myself older than I really am.
Seriously.
But I grew up in Canada, moved down to Texas when I was halfway through 10th grade. Um, I've never been one to go to the doctor for, all the little things. I was raised in a household where we just, if you had a cold, if you had an injury, unless you were bleeding to death, and even then, not always, we would take care of it at home. And so it was very much, we didn't use a lot of medications, it was sort of kind of an East meets West sort of lifestyle. And so that's always been in the back of my mind. Trained traditionally as a dentist here in Dallas. And traditional dentistry is, drill, fill, bill with a little bit more sprinkled in. And so as I began to practice, and I've practiced in a few different places in the DC area, Washington State for 7 years, and then back to Texas. It was always a struggle where I would spend too much time talking to my patients. And when you aren't the owner running the practice, they get kind of frustrated that you're not producing things. So
Yes.
you need to move faster, you need to be billing more, you need to do all these things. I'm like, well, that's fine, but I also want to understand my patients better. I want to make sure they're comfortable. I want to understand why they are where they are, and I want to make sure that they understand where they're going. And so ultimately, through some of my postdoc training, I learned more about just whole person dentistry. Where you really are looking at the teeth as the occupants of the body. And so you want to look at occupant safety and you want to look at how that applies to the whole body. So asking the right questions and taking the time to really look at what else might be causing changes to the mouth. And then as I practice more and more, a lot of female colleagues have a lot of issues with having babies, whether conception, maintaining, or even with their children, and then with their own health. And so the more I heard that, I started to learn a little bit about like heavy metal toxicity and what fluoride can do to the body, and just different things, and realized like we're in a very, very toxic field and we are exposing ourselves to all sorts of stuff every day, and our patients as well, and our team. And I didn't like that. And the more I learned, hey, there's different ways we can do this where we can still make the difference, but we can do it in a way that's kinder to the body. So that really got me into the biological or holistic dentistry realm, on top of just my personal philosophy with how I practice dentistry. So fast forward to almost 5 years ago, I bought this cute little Victorian house dental practice down the street from you, South Buckner, and decided I would rename it the Whole Tooth, not realizing that it was going to be a holistic practice. Just I wanted a whole person, whole body,
Yeah.
just where I could talk to people about all the things, because really it's not just your teeth, but it's your mind, your body, your smile, your soul. All of that makes the big picture, right? In terms of what we end up seeing in the mouth, which to me is really the portal or window to the rest of your body. But it also, you can't view it in isolation.
Yeah. And I
So
think people
that's,
don't even realize
yeah,
that because it's like, oh, I just go to the dentist to get my teeth cleaned. But in reality, the teeth are the first signs of something potentially going on with your
right,
whole body. And I don't think people realize that. And your practice is very similar to my practice. There's so much education that goes into play. Like if you're really wanting to prevent things and do things like this, you have to give a lot of education, which takes time.
right.
And that's I ran into the same issue with my practice. It's like, rush in, rush out. And I'm like, no, like I need to get to know that. Like there's so many questions I need to ask to sit down and really understand what's going on so that we can again, yeah, treat the whole body because it is, I mean, our whole body is connected.
Yeah, yeah, and it's amazing just to see, I talk with patients every day about, they're sitting in the chair and they're kind of, trying to figure out how to get comfortable. I'm like, gosh, is your neck sore? Like, what's going on? They're like, yeah, I mean, I always have this, and then I have these headaches here. And I'm like,
Yep.
okay, so let's look inside your mouth for a second. What's going on with your tongue? What
Yeah.
what is happening there? And they're like, what does that have to do with anything, right? And you're like,
Well, it's
well,
all connected.
and your tongue is a massive muscle. And so
Yeah.
if it's restricted or tethered,
Yeah.
guess what? You're going to have pain here, and you're going to have pain in your SI joint and your lower back, and then maybe your knees, because then you're compensating there. And
Yeah.
so it all sort of, it's,
Goes down the chain.
yeah, goes down the chain. And they kind of look at you like, whoa. Yeah. Yeah. And then if you ever have a chance to look at the cross section, or not like the side section of a tongue, and realize just how big this muscle is, all of a
Oh
sudden
yeah.
sense. So yeah, it's always interesting just to try and like connect the dots
Connect the
for.
dots. Oh, that's all we do,
Mhm.
because you have to connect the dots. And there's many ways to connect the dots, and it's not always the same way for every person. So like that's what
Exactly.
people don't understand. Like when we look at things, it's like these are the five things that we look at, but maybe only three of them are, but maybe it's one that's the problem that's creating the other two, but it could be three that's creating the first two. Like you don't know. Like it's just that's
Right.
where you have to like sit down and figure it out. It's a puzzle.
Mhm. Yeah, and you peel the onion and then you
Peel
realize,
the
okay,
onion and
well,
then
that
yep,
actually wasn't,
yep.
let's try this approach instead, because that wasn't quite
Exactly.
right. Yeah.
Exactly. So why dentistry? What was it about dentistry that you loved?
I so I decided I wanted to be a dentist when I was in, I think it was eighth grade.
Wow.
And it was sort of a multifactorial. So I had a dentist who lived across the street from me, and babysat his children all the time, and loved the lifestyle. They
Mhm.
traveled all the time, and he seemed to not work crazy hours.
Mhm.
In Canada, we had to do like a career survey thing where we had to just answer a bunch of questions, and then it would sort of give you
These are the ideas that
options, and dentistry was one of them. And I was like, well, that's cool. So I did a little more learning about what that would be. And, the ability to blend art and science was the big thing. So I wanted to be in the health healing field, but I
yeah,
didn't want to just prescribe a drug and never see the person again. I didn't want to see just sick people. Like I wanted to be able to connect and to be with them on their journey, and to impact their lives. But I didn't just want the straight science of it. Like I loved art, was my favorite, still one of my favorite subjects or things to do. And so to be able to leave my mark, call it what you will, on a patient's smile and on their lifestyle
yeah,
is still what, lights me up today. It's
yep,
being able to make that impact, and it keeps it rewarding.
yep. I mean, it's similar. Like I didn't want to be a doctor because I didn't want to spend like 10 minutes with them. I wanted to see them through the whole progress to see what happens. So like physical therapy just like fit it to a T. And then, you just all your life's experiences that you have just kind of creates the practice into what it is because of the things that you've been through, you're able to pull into your practice. So, and I've had many times where I was just so frustrated with medicine and had to go find other options, which then now I've been able to pull into my practice and just help realize, wow, they're going through similar things. Now I have places for people to go to that they actually can get really help, which is so rewarding when you, even if I can't help them and I'm able to send them somewhere else and they get
Exactly.
help, it's like they always come back and they always say like, oh my God, like, thank you. And I'm like, oh, it's just amazing that you can, impact someone's life that way.
Absolutely. And it always seems to start right at home, right? So it's, you're trying to figure out something to help your child, your
Yep.
parent,
Yep.
yourself, and that's what takes you down that rabbit hole, and it makes it so important because
Yep.
it matters in their lives. And
Yep.
then to be able to share that information with other people is a gift.
Yeah. Yeah. So who is your typical client?
So my typical client is someone who's really focused on wellness and health. So
Mhm.
people who are really either trying to get there, get healthy and feel better, or who are already living that life and they want to keep it that way. So a lot of times we tend to attract moms and or children first. And
Yep.
so it's sort of a trial by fire. Usually child goes in first and then they're like, okay, maybe it's my turn. Or maybe I'm going to send my husband in. Um, and I feel like a lot of them are like me. So when we look at like the people who follow us on Instagram, it's like
Or they're the same people
8%
because they
going
like,
to
oh, I like
vestibular
her
clinic.
view. And they, yeah,
Yeah.
I mean,
And
that's your marketing
so
message.
yeah, exactly. And that's it, right? We tend to market more to a female crowd,
Yeah.
but they also tend to be making a lot of the decisions. But I find some of our men patients to actually be the best patients, the most compliant, the most excited to be here because they like a female provider who's gentle, who has little tiny hands. Um, and then women enjoy being able to talk and commiserate and
Yes.
go through a lot of the things because women have their own set of challenges. And I think historically it's always been kind of brushed under the table. It's like
Yeah.
that's part of who you are. You get to deal with the stress, you get to deal with pain, you get to deal with these things because that's just what you do. You get
Yeah.
to be mom first or working first and then yourself later. And so a lot of those patients really enjoy coming to see us because we take the time, we try to make this more like a not quite spa experience, but a more relaxing
Yeah.
experience. So like we offer custom blended teas to the patients so that they can help kind of, decompress a little
Yeah.
bit. And then we just keep everything as calming and soothing as possible while also still having a good time. Because I
Yeah.
feel like you need to hear laughter in a place to really understand
Oh,
like it's
laughter like
a good
is,
time, right?
yeah, like it's great for the body.
Yes.
Totally
Yes.
great for the body.
We always have laughter because I usually say something dumb at some point in time that's just it's entertaining. I'm like, that's not the word I meant, but yeah.
Yeah, no, I'm always laughing. Literally, like it's like if you're not having fun, why do it type thing.
Yes.
So, and while we're torturing our patients, we don't really torture them, but they think
Oh,
that sometimes
that's
we're
so
also
good.
laughing at the same time.
Yes.
I mean,
Yeah, we have to kind of make light of some of these
yeah,
situations to make it more comfortable as well. So
yeah. We had a dad and a daughter come in today. And I was like, what's your schedule today together? She goes, oh yeah, I can't wait. I'm going to like see my dad and you're going to torture him. It was really funny. and they just badgered each other back and forth on the table while Corey was treating the daughter and I was treating the dad. So, and I mean, that's fun too. Like getting the whole
yeah,
family and you just make it a family affair.
we often have family affairs and there's just things going on up and down the hallway and
Yep.
you're like, oh, where did that child go? Somewhere. We had one, he went rogue and he was only going to get one prize. That was the agreement. And he decided not only did he want a prize, he also wanted a lollipop. And we're like, okay, well, next time you can have a lollipop. While mom's in the chair, sister's in the front, like playing with something. He walks into the room with this lollipop and he's like, I can't get the wrapper off. I'm like, great. This kid's like 3 feet tall. All the lollipops are in this like really tall jar that has a glass lid that's on a countertop. I'm like, how? How? And mom's like, I mean, he's been like this since he was two.
Yeah. He's climbing up on everything.
Yeah, I'm like, probably better. I don't know what he did. And yeah, it'll be fine. We didn't hear any loud crashes and
That's good.
got his lollipop.
So what do clients love the most about your practice?
Mm, the most. Well, obviously me, but
Of course.
of course. I think just we try to make, I mean, the focus is really on really getting to know the patients and asking why again, and really creating that relationship and partnering with them as they go through their journey. And so, what that means is not just, we just don't do something and send patients on their way, but we want to be checking in with them. We want to make sure that things are kind of customized to them as much as possible. And so, a lot of times, like holistic dentistry kind of gets a rap as being very woo-woo. And there are some components that might be woo, but most of what we do is actually really heavily evidence
Space.
based.
Yeah.
And so it's not just, hey, you have inflammation, but let's measure this. Let's take a sample of your saliva. Let's swab your biofilm and stick it under a microscope. And then let's talk about what's going on. And based on that, develop a custom plan versus, okay, so you've got like these deep pockets and your gums are bleeding. So we're just going to numb you up and scale your teeth and bring you back in 3 months for maintenance. And perpetuate the problem because we never actually fix the
Fix the
cause.
problem. Yep.
Yeah. And so I think that combined with I'm perpetually learning, like probably to a fault. But
Yeah.
what it means is every time patients come in, I've got something new that I want to share with them or talk about, or, something we're integrating into their visits that allows us to continue to grow and take care of them better. And it means sometimes we have to pivot and change course of treatment because I've figured out a better way to do things.
Yep.
But I think ultimately it benefits them. And I think most patients are really excited to hear what it is that we're up to and what we're learning presently and
Yep.
what that means for their health. And so, yeah.
Which is exciting too, because it's just more education for them. And like, oh, wow, you can do that. Like, that's really cool. Yeah, let's do it. Let's give it a try.
Exactly. Exactly. And then they teach me stuff too. And I think that's always
Oh, yes.
really
Always
cool.
learning. I
Yeah.
mean, always learning from patients. I'm always learning from other people. Like, I'm just always open to like, oh,
Yeah.
okay.
Yeah.
Yeah. Never heard
And
of
it
that
might
before,
be,
but yeah.
right? Yeah, exactly. And like, cool. So skincare regimens that I've never heard of. This is
Yeah.
very interesting
Yeah.
to, I mean, you name it, right? Or some,
Gardening.
yeah,
Too.
yeah.
Yeah. Like, yeah.
Yeah,
Recipes. I'm like, oh, yeah, send me that. That sounds
I've
amazing.
got one on my bulletin board right here that I still need to try. Yeah. It's always something. It's
Yeah.
just, it's fun to share and
Yeah.
especially to share with like-minded people who
Oh,
have,
absolutely. Yeah. That's the
so.
best part. So, I mean, I know what really separates you from other businesses, but let's just talk about it. Like I mean, besides being holistic, what separates you from other dentists?
Um, well, it's always a tough question, right? Um, I dance to my own tune. So what I do in our practice is not because other people do it a certain way. I do it because I believe it's the right way and it's the best way. Again, sometimes to a fault, because sometimes that means that it's not something that's actually like productive for me, but I think it's interesting and
Yeah.
I'm curious and we're going to add this in. I think I'm just super quirky and again, love to have like real conversations with
Yeah.
patients and just be very authentic. So, for example, yesterday my parents were staying with us because my husband was out of town, and so I get extra support with the kids. And so I come out of the bedroom and I'm wearing like a nondescript t-shirt and some like joggers. And my mom looks at me and she's like, "Are you going to work like that?" Yeah. She's like, "Oh, oh, okay." I'm like, "What do you mean?" She's like, "It doesn't look professional." And I'm like, "Well, I'm gonna throw a jacket over the top, number one. So the top's covered. And then I need to be comfortable because I don't sit like a girl when I'm in the dental chair. So I've got
Yes.
to be in things that stretch, right? And sometimes I'm on the floor. Like if we've got a little bitty person, I might roll out a yoga mat and sit myself on the floor and we're gonna do this there. And then on top of that, like I just get messy and dirty. So like,
Yeah.
why would I wear slacks? I did. I have practiced in slacks and I got stuff on them. I was like, this is a waste of time.
Oh,
Um,
yeah. And then they just would
right.
rip, like you'd have liners and they would rip. Like
That
I did
has
the same thing.
happened.
I was
And
like,
you're like,
I'm done. I'm just like,
this is not going to
I
work.
can't move in this. Like I'm on the ground, like, on the table. I'm just like, no.
Yeah, no. And so I'm like, no, I'm going to be pragmatic about this. Like, this is what I'm going to wear. And there may be days where I wear a scrub top and need to look a little bit more professional or whatever. And that's fine. But like, based on my schedule, I didn't see a need to get fancy. And so, and then I got home and my aunt and uncle are in town right now. And so they had been over and my aunt looked at me and she goes, "Did you wear that to work?" I did. And you know what? No one said anything here because I'm the boss. So it's just what it is. So I'm like, no,
I am the boss.
right. They're clean. I wash them. They don't smell bad.
Yeah.
There's no holes in them. Like they just so happen to be comfortable. And if you like my team, Jessica at the front is a yogi. Like
Yeah.
that's what she does. And so I expect, we want to look clean and professional,
Yeah.
but also for what we do, I don't feel like we need to look super stiff. I also don't love scrubs in general, unless they don't look like scrubs, just because
Yeah.
I feel like it's that white coat syndrome. And so like having,
Yes.
like the
Yeah.
jacket you're wearing, I prefer that and stuff that just doesn't look quite so intimidating to
Yeah.
patients.
Yeah.
Did I answer your question? I
Yeah. I
dance
think you
too.
did.
It's
Yeah.
really, I just do my way. And sometimes it's good and
And I love
sometimes
that.
we have to change it.
So how can people find you?
So we are on most social. I keep needing to get onto like YouTube and TikTok, but maybe one day. So you can find us at thewholetooth.texas.com. No, yes, at thewholetooth.texas.com on that's our website, and then at the Whole Tooth Texas, and Texas is all spelled out on Instagram and Facebook. And usually a lot of patients will reach out to us via the website because we've got like a little link that'll you can fill out a form. You get to tell us how you view your body. Do you view it as a temple? Do you view it as, age is nothing but a number, different things, just a quick screening tool for us.
Yeah.
And then it gets emailed to us and we reply.
Yeah, and I'll put all that information in the comment section so people can grab that really easily. And I'm also super excited because we're going to be doing events next
Yes,
month,
yes.
and it's going to be fantastic. So we're going to be talking about just more of the holistic things that happen within our mouth, but also going into some TMJ type stuff and just how everything through here is all connected to our health and all that good stuff. So it'll be fantastic.
It'll be so fun. I'm looking forward to it.
Yep. Awesome. Well, thank you so much for coming on. I love your story, and I know other people are going to as well.
Yes. Well, thank you so much. I can't wait till next month.